name is Oscar Llorente, Community Relations Director for Mount Sinai Medical Center. Thank you very much for joining us today to several of the Mount Sinai and Sunny Isles Beach Physician Lecture Series. Today's speaker is Dr. Asuncion, Internal Medicine and Primary Care Physician at Mount Sinai Sunny Isles Beach Primary and Multi-Specialty Group. Joining her today are three residents, Dr. Angel Porras, Dr. Hubert Golingan, and Dr. Lee Seifer. After the presentation, Dr. Asuncion will answer any questions that you type in the box. Without further ado, I would like to introduce Dr. Ana Asuncion. Thank you.
What do we do now?
Just pop up. And then hit the share screen.
She's supposed to, no. Okay, share screen.
Yeah, no.
What do I do?
And then share the PowerPoint.
This one?
Yeah, click there. Double click it. And then hit play from beginning.
I don't know what to do.
Hit play from start. Like here.
Play?
Yeah. There, now it's just like a regular PowerPoint.
What did my
Now just click the PowerPoint dot. Just click it. There you go.
Okay.
And then Lee will take over.
All right. Good morning. My name is Dr. Ana Asuncion, and thank you for having us this morning. I've been with Mount Sinai for the past 2 years. I practiced internal medicine. Previous to working at Mount Sinai, I was in private practice for over 20 years. I have the pleasure of working here at Mount Sinai, and teaching is one of my favorite things. I have a panel of young physicians that I'm training. They work with me in my office. If you come and visit us, you will see me and you will see one of my residents. If you, you also have the option not to, but they are very well knowledgeable and they're up to date with everything. Today, our lecture is on the importance of the flu vaccine, and we will also touch upon the pneumonia vaccine. I would like my three young physicians to present this lecture to you. At the end of the lecture, I will be here for questions and answers. The first young physician I have, he's an intern, he's working with me. His name is Dr. Lee Seifer. He's going to talk briefly about what a virus is. Then the next speaker will be Dr. Angel Porras, who will talk to you about the flu vaccine. And then the third speaker will be Dr. Hubert Golingan, who will be speaking about the pneumonia vaccine. Then we'll have the question and answer. Without further ado, I have Dr. Lee Seifer.
Hi, everyone. My name is Lee Seifer. I'm a medical resident here at Mount Sinai Medical Center, and I'm also a Miami native. Grew up in Miami, and I went to medical school at FIU. Just going to give you a little talk about introduction to viruses and a little bit about the respiratory tract. So what is a virus? Obviously, it's become very popular, the idea of viruses in the media, thanks to coronavirus. So a virus is essentially, it's a very small entity. It isn't really a living thing compared to something like bacteria or fungi. However, they are similar in size and in their implications on human health. We say that they're not technically living because they cannot reproduce outside of human or other, host animal cell, other hosts, animals or other bacteria. So essentially, it's more, consider it as like a little protein. And then when they invade a human cell, they can essentially take over the machinery of our cells and enable our body to basically reproduce the virus for its own purposes. And when a virus does that, they can cause, diseases, or they can simply not do anything at all. One of the most common examples that we'll be talking about today in particular is the influenza virus, which causes the flu, and there's other viruses that cause the common cold. The tough part about viruses is because they're not living, they can't really be killed with common means such as antibiotics. So I'm sure it's happened to many people before where you've come in, with a sore throat and your physician has diagnosed you with a viral infection. And a lot of times we don't want to give antibiotics. And that's not because your doctor is trying to torture you. It's really just because antibiotics don't work at all to kill the virus, and we don't want to give you unnecessary drugs that won't help you and could have adverse side effects. I'm going to talk a little bit now about viruses and where they infect us in terms of the respiratory tract. So the respiratory tract is a fancy word, fancy phrase for essentially outlining the entire system that composes how we breathe in air and how it's diffuses from our lungs into our body. So the first part of the respiratory tract, it starts in your nose and it goes into the back of your throat, and down in the back of your throat is called your pharynx, and then it goes a little bit deeper towards your voice box and your vocal cords, and that's called the larynx. So that upper portion encompassing your nose, also known as sinuses, the pharynx and the larynx are known as the upper respiratory tract. Upper because it's most distal to the inside of your body and most close to the outside world. Now, if you go a little bit deeper from the larynx, you get into something called the trachea, and a little bit deeper, the bronchi, and then the actual main gas exchanging part of the lungs called the alveoli. And this lower part, or what we call proximal part of the respiratory system, is called the lower respiratory tract. And you can think of that as the encompassing part of the lungs. Now, how does this relate to viruses? The funny or interesting part about viruses is that they can infect either portion, the upper or the lower, or even both parts of the respiratory system. That's why there's such interesting entities and why we have such a variety of clinical representations. So I'm sure everyone has heard about coronavirus and how the variability of the presentation varies so greatly. For example, you have some people who just lose their sense of smell, and that's because the virus infects the upper part of the respiratory tract, such as your nose and your sinuses. Or you have some people who will end up very ill in the ICU and they can't breathe because it's really damaged deep down into the respiratory tract of the lower part of the lungs. So it's hard to know which part of the virus which part of the respiratory tract the virus will infect. That's why it's important to take precautionary measures. To relate this to another common virus, the influenza virus, which we will talk about in greater detail, it is very similar in respect to coronavirus because it can attack any part of the respiratory tract, either the upper, the lower, or the both. And just a little interesting point is why the coronavirus and the flu are so contagious is because they tend to affect the upper respiratory tract very significantly. And because the upper respiratory tract is close to our mouth and close to, where we put our hands in our mouth and our saliva, that easily enables spread to other people. So depending on where the virus is, in conclusion, will affect your symptoms, and then that will affect how you feel and how sick you will get. So now I'm going to hand it off to one of my co-residents, a second-year resident at Mount Sinai Medical Program. His name is Dr. Angel Porras.
Good morning, all. Dr. Porras, like my colleague Dr. Seifer said, we're here to talk to you mainly about what the flu is and the importance of the flu vaccine. So, like this image, the flu, like Dr. Seifer was talking about, is a virus that comes every year. It's a seasonal flu. I like this image because it talks about three of the most important things the take-home messages we want you guys to understand after this presentation. Basically, if you want to help protect yourself, your family, and your community from the flu, you can get a vaccine. You can help stop the virus by sort of like washing your hands regularly during the flu season. If you're sick, staying home. As we all know now, during the pandemic, the importance of social distancing. And finally, 3, if you do get sick and you go to the doctor, taking the antivirus if the doctors think it's you will need it. So I like this image here from the CDC, the Center of Disease Control. It talks about how the flu is a serious thing that happens to our country every year. Last year, in the period from October to January, so just in 3 months, there was 15 million people who got the flu in the United States. This caused 7 million people to go to the doctor, 140,000 people to go to the hospital, and unfortunately caused 8,200 deaths. So the flu is not the end of the world, but it is an important thing. It is a thing that causes a lot of people to get really sick, to end up having to go to the hospital, to miss work, to go to the doctors, and unfortunately it does cause thousands of Americans to die every year. So the flu is a virus. It's a virus like Dr. Seifer was talking about. It causes a whole constellation of symptoms. It causes fever, cough, body aches, many other symptoms. I like this image here also from the CDC. Talks about the difference between the common cold and the flu. Basically, much like the flu, you'll get fevers, aches, and chills and sneezing. This image here talks a little bit about the differences between the two. For example, the flu is usually a bit more abrupt in onset. That means it comes on you faster. The cold, usually you're like moderately sick for a few days before you start feeling the full effects. Usually you're more likely to have fevers, serious body aches. Like a lot of people have lower back pain. The fever can be pretty bad, giving you chills. You can have weak. Sometimes when people have the flu, they describe being like wiped out, or they don't have the energy to do anything. Less sneezing, so you still get upper respiratory symptoms, but less typical than the common cold. Coughing is still there. You can get a sore throat and a headache. So pretty much the flu can make you feel really bad when you have it. There's different types of flu. So in the news, sometimes like a few years ago, they'll talk about the swine flu or the bird flu. The flu we're mainly talking about is the flu type A and type B. This is a seasonal flu that occurs every year. This is the one that the specialists make vaccines for. So the big question, as we talked about in the previous slide, is the flu dangerous? And it can be dangerous. Like most people who get the flu will resolve on its own. You just need to stay home. But unfortunately, some people pass away of the flu, especially if you're at high risk. For example, people 65 years and older, people under 5 years of age, pregnant women, and people with certain medical problems. So we have to take the flu seriously, and that includes getting the flu shot, staying home if you have the flu, and taking treatments if your doctor thinks the treatments are indicated. Is there a flu test? Yes, there is. If you go to the hospital or to a clinic because of the flu, they'll likely test you. This is especially important now in this time of the coronavirus because if you have the flu, it can mean you don't likely to have the coronavirus. You can have both going on at the same time. So the good news is you can't get tested if you suspect you have the flu. Okay. So how can you protect yourself from the flu? Like we were talking about, washing hands is very important. Every time, this period of time from May to December is the flu season, but it's also, the cold season, a lot of viruses in the winter months. So always wash your hands. Wash your hands frequently with soap and water, especially if you're in a place like a public place where people are touching door handles or other common surfaces. Socially distance if you feel you have the flu. So if you have symptoms of the flu, try to stay home. Wear your mask, especially nowadays with the coronavirus, and we're all wearing masks. And get the flu vaccine every year. The flu vaccine, we're going to talk in more detail, but I think it's something important, something most people should be getting. What should you do if you get the flu? Like, for example, if you have a fever, some backaches, for the most part, you can stay home, rest, and hydrate. At home, you can take Tylenol, Motrin, other over-the-counter pain medications or anti-fever medications, lozenges if you have a sore throat. Very important, if you have a child who you suspect has the flu or the cold, avoid aspirin. There's a rare syndrome called Ray's disease that is a life-threatening if sometimes when a child with the virus gets aspirin. So try to avoid aspirin in children. If you have the flu and you have serious symptoms, like you have shortness of breath, chest or belly pain, you're vomiting, you can't keep food down, you have any sort of confusion, then you should call a doctor. If you call the doctor's office, they'll likely want you to come in. Obviously, if you have significant shortness of breath, you feel very, very ill, you can even present to an emergency department of urgent care. So the next question, what if I am pregnant? Pregnant women are at higher risk for complications due to the flu virus. So if you're pregnant and you suspect you have the flu, you should call the doctor. Most women with flu, we tend to treat them with antivirals. So if you're pregnant, you think you may have the flu, contact your doctor. Very important for women who are pregnant or plan to become pregnant. The flu vaccine is very important. We'll talk about that in the next few slides. So can the flu be treated? Yeah, there's a class of medications called antivirals. One class of antivirals is the anti-flu viruses. It's a virus that prevents the flu from leaving cells that it is infected. The compound is named oseltamivir, but you've probably heard it referred to as Tamiflu. Is the most common one. It's a safe medication, commonly used medication. So not everyone with the flu will need Tamiflu. Most people, like I said, will probably just stay home, stay hydrated, take some rest. But if you have symptoms of the flu and you come to the emergency department or you see the doctor within 48 hours of symptoms, they may treat you with Tamiflu. If you are unfortunately hospitalized for the flu, they will likely give you Tamiflu regardless of how long you've had the symptoms. Try to just take into account how long you've been having symptoms, but usually it'll be the doctor or the whatever provider who sees you who will decide if you need the treatment in that. As my colleague Dr. Seifer correctly talked about, the flu is a virus. It's not a bacteria. Very different types of organisms. So the antibiotics do not treat the flu. Very important, if you see a doctor, they exclude any sort of bacterial cause of disease and they recommend not taking antibiotics. Try not to take antibiotics. It won't kill the flu. Antibiotics have side effects, and it's best not to do so. Okay. Like I said, Tamiflu is a very safe medication, very commonly used medication. Some of the side effects of Tamiflu can be fatigue, vomiting, nosebleeds, abdominal discomfort, and headaches. Okay, now we'll talk about the flu vaccine. The flu vaccine is something that if you come to our clinic, we're gonna recommend to you guys. It's a very important thing every year in preventing complications of the flu, of people losing days of work to the flu, of just overall not getting sick. So the flu vaccine is every year scientists, based off last year's flu virus, they create a new virus. Basically, it contains inactivated particles of the flu vaccine. So they either kill the virus and they put it in a safe suspension so your body has it develops immunity to strains of the virus. So there's two big types. There's the inactivated, which is the more common one, which we inject into your muscles, or the nasal spray, which they get the virus and they weaken it, so it's no longer able to cause infection. Usually, the doctor will be the one who decides which form of the vaccine you will receive. Who should get the flu vaccine? Pretty much anybody over 6 months old. If you're under 6, your immune system isn't robust enough to benefit from the virus. But afterwards, it's a very safe medication. Very, very, almost everybody should be getting it. This is especially important for people at high risk for complications of the flu. Here on the right side of the slide, we have the different categories. Children age 6, very young children are at risk. Very important to get children vaccinated. Adults 50 and older, especially those over 65. People with health conditions such as COPD or asthma, heart disease, previous heart attacks, diabetes, very, very obese people. People with diseases that impair their immune system, like those with HIV/AIDS, those who received their organ transplant, or those being treated for cancer. Pregnant women, children who take aspirin for another medical condition, people who live in nursing homes. And so almost all of us know a person that falls into one of these categories. So that's why the flu vaccine is important. because not only does it prevent us from getting the disease, but it also prevents those we care about in our community from getting it. So the best time to get it is before the flu season. So the flu season usually fall through winter. So we usually start giving it out in May. And then finally, like, why should I get the vaccine? It keeps you from getting sick, and it protects those around you. So it is true. If you read about the flu vaccine, some years the flu vaccine is more effective than other years. For example, some years the flu vaccine protects up to 80% of people from getting the flu. Some years it's like closer to 60%. Even though it doesn't protect 100% of the time, it can keep you from getting sick, even if it isn't as effective. And if you do get sick, it can protect you from having a more severe complication of the flu vaccine. Finally, a lot of times we speak with patients and they'll tell us like, oh, you know, like I got the flu vaccine and I got still sick. Unfortunately, the flu season is also the cold season. So a lot of times people get the flu vaccine and get a cold and they'll think that they got the flu. But in reality, they just got a cold and they didn't get the flu. So always try to get the flu vaccine. Side effects of the flu vaccine, they're often nothing. The majority of people who get the flu vaccine won't have a reaction. But if you do, it'll usually redness, soreness, and swelling at the site of injection. Sometimes people get a mild temperature for a few days and a little bit of a rash or headache. But serious side effects are rare. The most serious side effect is an anaphylactic reaction or a very strong allergic reaction to the flu. This is very rare. Unless you've had a previous allergy to the flu, this is unlikely to occur. Does a flu vaccine cause a flu? No. Like we were talking about previously, they either kill the vaccine or they make it too weak to infect. So if you do not have an immunocompromising condition, the flu vaccine will not cause the flu. Does a flu vaccine cause autism? No, absolutely not. It's been extensively researched. The flu vaccines and other vaccinations have not been shown to cause autism. What if a patient is pregnant? It's even more important. Flu is more dangerous in pregnant people to mom and baby. So it's important for women who are pregnant or planning to get pregnant to get the flu vaccine. In the past, some of the egg-containing products were used to create the vaccine. So if you have an egg allergy, just let your provider know. For the most part, the amount of eggs still used is too small to cause an allergic reaction, but the doctor will choose which type of flu vaccine is safest for you. And then finally, should I get the flu vaccine during the COVID-19 pandemic? It's probably even more important now this year to get it. You want to stay outside of the hospitals during the pandemic, and we want to prevent the hospitals in the community from getting overwhelmed. Every year we have a spike in hospitalizations due to the flu. So we can take an active role in taking care of our community by getting the flu vaccine, so we're less likely to end up in the hospital, and hospitals are less packed. Okay, so now I'm gonna go ahead and hand off the presentation to my colleague, Dr. Golingan. He's gonna talk to you guys about pneumonia and pneumonia vaccines.
Hello and good morning. My name is Dr. Hubert Golingan, and I will be talking to you about pneumococcal disease. Unlike the influenza, pneumococcal disease is caused by bacteria, and the vaccine itself will protect you from this particular bacteria. Pneumococcal disease is also the second most common cause of vaccine-preventable death in the US. So let's talk about a little bit what can this bacteria cause. It can cause pneumonia, most commonly, and bacteremia, and meningitis. Now, what is pneumonia? So pneumonia is an infection of the air sacs in one or both of your lungs, which can cause a variety of symptoms, including cough, with mucus production, fever, chills, and difficulty breathing. So pneumonia in and of itself can be caused by bacteria, viruses, and fungi. This particular vaccine will prevent bacterial pneumonia. Now, pneumonia is also common as a complication of influenza and measles. So let's go over a little bit what's bacteremia. Bacteremia is when you have bacteria in your blood, and this can be caused by a number of things, such as dental bleeding or medical procedures. Pneumonia can cause bacteremia from hematogenous spread or spread through the blood. And pneumococcal disease can also cause meningitis, which is inflammation of the fluid and membranes, also known as your meninges, surrounding your brain and spinal cord. And I have a little picture on some of the signs and symptoms of meningitis. So you have a fever, vomiting, headaches, sleepiness, confusion, seizures, etc. Also a headache, fever, and stiff neck. Those are commonly triad of meningitis. Now, why is it important to even receive this vaccination? Although pneumococcal disease is commonly found in young children, adults tend to be a greater risk, especially if you have many comorbidities. In addition, there's also a possibility of getting a super infection with the flu and having bacterial pneumonia. So this is why we, as physicians, recommend having both. Now, there's two vaccines, Prevnar 13 and Pneumovax. And the question is, when do you get it? So these are the people that we want to get the pneumococcal vaccine. So all patients greater than 65 years of age, or people between 19 to 64 with asthma or who smoke cigarettes, or those same group with chronic medical illnesses. So adults 65 and older. The CDC recommends getting Prevnar 13 first, and afterwards you get Pneumovax 6 to 12 months after the first vaccine. This age generally requires both vaccines in order to have proper protection from pneumococcal disease. Next is adults 19 to 64 years of age. Generally, you don't really need this vaccine unless you have asthma, diabetes, heart disease, alcoholism, or liver disease, as well as cigarette smokers, residents of nursing homes or other long-term care facilities, and should be getting the Pneumovax vaccine. And when you turn 65, they should receive an additional dose of Prevnar 13. And finally, the high-risk patients who should receive both Prevnar 13 and Pneumovax. So some of these features include those patients with functional and anatomic asplenia. What this means is like people like those with sickle cell who happen to have a non-functioning spleen, patients with cochlear implants, those patients with cerebral spinal fluid leaks, if you have a history of lymphoma, leukemia, or Hodgkin's disease, or those who had an organ transplant. You should receive Prevnar 13 first, and 6 to 12 months later, receive the Pneumovax vaccine at ages 19 to 64, okay? And now I'll be ending this presentation, and Dr. Asuncion will be coming on to answer any questions.
Hello again. I'd like to thank my panel of young physicians who presented a wonderful lecture on the on viruses, flu vaccine, and pneumonia vaccine. So I'm here to answer any questions you may have. I'd also like to emphasize that it is very important for everyone to get the flu vaccine this year. I've had many patients come in who normally don't take the flu shot, but because of this COVID pandemic, many have come in requesting to take it. So I really encourage that everyone take the flu shot. Many times I have patients who come in saying that they've had bad reactions to it, and I want to negate the notion that the flu vaccine causes the flu, because that is not true. But anyway, I'm here to answer any of your questions, and my residents can answer any questions as well. You have a question with regard to their slides.
They're asking, should I get the flu shot every year? Somebody asked in the chat, should I get the flu shot every year?
Yes. So someone is asking, should you get the flu shot every year? The correct answer is yes, you should. Okay, it's important. The flu is a virus, and the viruses change every year. They mutate. So even though you got the flu vaccine this year, you need to get it next year. Any more questions?
Okay, Dr. Asuncion, thank you so much. At this time, we don't have any other questions in the chat. So I wanted to take this time to thank you and the panel for an incredibly informative presentation. If there's anything else that you'd like to add, or we can conclude the presentation.
Well, thank you for having us.
All right, wonderful. Thank you to all the viewers that tuned in and those of you that will watch later. I hope you enjoyed it. So thank you very much.